Welcome to PCR 2024. I am Sevket Gorgulu. I'm from Istanbul and I have here two experts, my friends. I have Jianfang Luo from China and we have Benjamin Faurie from France, and we are going to discuss three devices which will ease our daily complex PCI routine practice. So we will discuss three topics today that the devices that we are using in complex PCI. Luo, just begin with you. I have a question regarding this complex PCI topic. So you are using a lot of guide extensions because if you are doing complex PCI, you have to use guide extensions to some extent, in some cases at least. And we have the Expressman here, which has a unique features. What would you like to say about Expressman that differs from the other guide extensions?
I think Expressman is got a very core functions for the every guiding extension catheter. I believe backup support is very important. For sometimes if our guiding catheter is not so good for the backup support, we can use that, it's no doubt. And sometimes we have the facing to the tortuosity, even the calcified lesion, we need that. And I don't know, you guys may be right now doing a lot of DCB, drug eluting balloon, sometimes more stiff, not even the stent, sometimes we need the guide extension catheter to deliver the DCB. That's the good things. The other thing is the new design is a one-piece design. So it's a very good possibility and stable and very good unfracture functions, I believe so. So either more, this catheter, I believe there's two very unique functions. There's a taper design and the side hole design. Yeah, that's very important and very friendly use.
Yeah, the tapered, as you mentioned, is very important. I think they have the 4 French tapered tip design as well, and it will also prevent any pressure dampening. And as you mentioned, the 4 side holes will keep the ischemia even more down, so you will not encounter any ischemia. I think one of the features of this guide extension, as you mentioned very well, is that.
I believe the side hole design is very important. I don't know any other products have this function. From here, we can see 2 side holes. The more distal side hole draws right to the 30 centimeter to the tip. So it's a real helpful sometimes when we do the, for example, LAD, long lesion, something like that. The proximal flow can through the side hole all the way down to the distal. That's very good things. And more safe, avoid the damping. Second, when we do the tip injection, you can evenly spread out the pressure, so more safe when you do the tiny injection. But anyway, every time you want to do the injection, you be very gentle for this one. And also for the tapering is, I think, it's very important. I know you guys is a CTO man. Sometimes when you do the retrograde approach, you really want to have good support for the microcatheter. If got the taper design, probably you can go maybe the proximal of the collateral, something like that, even deeper.
The next topic is Elong.
It's no doubt for the CTO man, microcatheter is real important. Elong, I think, is a good device for the CTO intervention. So how about your experience, gentlemen? Benjamin?
Thank you, Jan. First of all, to select a good microcatheter, you need a good passive support and also a good active support in most of the time. And I like to choose my microcatheter by saying he who can do the most can do the less. So if you have a good passive support and on top of that a good active support, you can do every complex PCI and every CTO cases. That's what I like in this microcat.
Yeah, but sometimes if you guys experience probably 2.6, it thinks a little bit big profiles. But why you use that for the retrograde approach? Why?
Yeah, this is a good question. And I experienced many cases when thinner microcatheter couldn't cross a septal or a collateral. And with a thicker microcatheter, due to this capability, this coil conception could cross even with a thicker profile. This is really the everyday practice, and that's why I like it.
I have the same experience actually, so I totally agree with Benjamin what he has said about this Elong 2.5 microcatheter. It's a real excellent microcatheter, torqueable microcatheter. For me, one of the best, I can say.
And moreover, you have special feature in this microcatheter. For example, you have a guide extension incorporate in it, so you can use it sometimes.
That's important.
Yeah,
right.
This is important.
Yeah.
And that's quite that. And you have different length. This is also very cool. You have 130, 150, and 170. And I remember some cases where I used the 170 for retrograde to get directly into my antegrade case guide and to do my guide extension, my guide wire extension. This is the procedure, and you have to choose long guide wire, of course, not short one. But this is a special feature that I like.
And I think the structure is also unique because this is an even coil. That means you have a better coaxial, you have a better axial support. And if you are in the coronary artery, you have actually better support that's coming from the microcatheter. And another thing is the inner lumen is coated with PTFE. That means the wire that has less probability to get stuck inside the microcatheter, which we can sometimes encounter during retrograde procedures. So I think that makes this microcatheter in this sense also unique.
The things you mentioned about the cooperate is very important. So guide extension and the longer maybe sometimes can get done the retrograde approach.
Yeah.
So.
Yeah. And when you are retrograde and you cross, you have to dilate.
Yeah.
So you use a balloon.
Yeah.
So what kind of balloon and what kind of innovation can you explain?
No, the topic is now the Lollipop. So the Lollipop is a real invention for me because there are some unique cases that I have experienced with this balloon. But when we talk about the scientific issue, we have the Reconquista trial. And this Reconquista trial showed us that with tapered non-compliant balloons, when we cannot cross the stent, for example, for post-dilation, because we have to post-dilate the stent in order to prevent any re-occlusion and restenosis or any acute coronary syndrome. So after stenting a calcified lesion, we should post-dilate properly. And first we have to pass into the stent. And passing into the stent in tortuous vessel may be sometimes very difficult. And in that sense, Lollipop helped us a lot. And we have now undergone another study. It's a prospective randomized trial. The centers, there are 16 centers in China, and we are also included in this study. And we are trying to make comparisons between tapered ones and the spherical one. The spherical one is the Lollipop balloon. And how this Lollipop is functioning is when you push the tapered non-compliant balloon, sometimes you get stuck in the proximal edge of the stent. And if you force too much, then you get stent malfunctioning. Right. And in order to prevent that, you have a spherical type, and this spherical type slides easily into the stent. And if you have even a tortuous lesion, you are very easily to manage to go into the stent and post-dilate it. And I have just one unique experience I want to mention. I have talked about that at lunch with you guys. We have talked a lot about the APT products, but this one is very unique. I made a culotte procedure, okay? And in this culotte procedure, sometimes you have to pedilate the strut that's facing the side branch, okay? And in this case, I wanted to see if any non-compliant balloon would go through the struts. It's impossible, of course. I tried a straight one, 3 point something, and then just out of curiosity, I wanted to see what Lollipop would do crossing two struts, okay, and going into the side branch. And it went easily and smoothly into the side branch. That was fascinating for me, and I said, this balloon is something different, and I am very also amazed by this product.
Maybe you mean with the Lollipop. I don't know this device, but I like it first because you avoid the problem instead of facing it.
Yeah.
Because when you are in the convexity of the vessel, you need to push. But if you can push, you push against a wall, against calcium, against stent. And it makes me think about the wiggle wire, which is wiggling the nose of the device to avoid the problem instead of facing it.
I have a question for you.
Yeah.
At that case, do you use a double wire, even the body balloon, to cross the stent?
Yeah, this is a good
That's
question.
a technical issue.
This is a good question. One of the intentions of this Lollipop balloon is we want to avoid any guide extension. We want to avoid any anchoring. We want to make the procedure more complex than already it is, because we are facing complex lesions. And if we do anchoring balloon, then we can damage the donor artery, for example, or if we do it inside the stent, we can damage the stent, even it's a donor artery or the anchor. And if we use guide extensions, and guide extensions are, costly, then we increase the cost. And if we try too hard, we can do maybe stent malfunction. In that cases, I think Lollipop is very useful in crossing this kind of lesions by preventing any usage of body wire, or making the lesion more complex, making the procedure more complex, or even avoiding guide extensions. So I think that's one of the beauties of this Lollipop balloon.
Okay,
So I would like just to thank the industry and the engineers to think about this and to making our life more easier. And to making those procedures more simple. Not simple, but more simple.
But one thing I want to point out for the Expressman, because it's a side-hole design, I think you guys maybe intervene the TAVI, right? Sometimes we have to protect the coronary. We have to use a guide extension catheter. If you got the side hole there, it's more safe, right? You got the flow to the coronary. Because we got a one case trouble is all the way down and then block the LED flow, and then the patient just down. Yeah, that's very unique. I think I like it a lot. Probably eventually it will be the standard setting for TAVI when you protect the coronary.
Instead of doing a Kemeny technique, complex technique.
There is something unique in this guide extension as well. The exchange length is also unique, okay, with 35 centimeter in length. And the one piece, fashion of this one is also important, because the entry point is larger. So in some guide extensions, you may encounter some stacking of the stent at the entry point. So to hindering that, I think these features are also very important.
Yes, you're right. Actually, here is a little bit flare, and it's easy to let the stent wherever to go.
Because this is one piece, and the other guide extensions are they have the rod, stainless rod, and it's attached to a ring. It's and then it's attached to a mesh braiding, and this three-piece structure may cause problems. We don't have this with the Expressman.
Benjamin, how often you use the guide extension to block the flow, antegrade flow, and do the ADR, something like that?
This is a good question. I like these extension guiding devices for blocking the flow during ADR procedure to keep my subintimal space as dry as possible, because we know that it's a factor of failure. So I like it, and I must admit I was doubtful about the side hole at the beginning, but I tried it, and I saw that it's working. It's working very well.
Okay, Benjamin, let me ask you the last question. Okay, so you mentioned about the extension wire, and it's coming out of every APT product in terms of microcatheter. It's coming out from the Elong dual lumen, from the other microcatheters, and it's coming out of this one here. And how useful is it? Can you give us an example, for example?
Yeah, I had an example last month where I get many devices in my guiding catheter, so I couldn't use a trapping balloon. So I was happy to have this microcatheter and the guide extension ready on the table, universal for every wire. So you have to know it, because at the beginning you think it's only a Mandarin, but it's a guide extension.
That's a good point.
How about your balloon? Lollipop.
Which balloon?
Lollipop.
Okay, Lollipop, you want me to say something more? something more about the Lollipop. So I think the randomized trial that we are now conducting, will give us a better understanding, at least from a scientific point of view. What we are talking is about, of course, the experience is important, but we need also, as hard, sound evidence to back up our experience. And I think it will come. And the preliminary results of the study is very encouraging. So the results are coming and they are good, okay. They are in line with our expectation. And Lollipop, I think, will be a real player in terms, I think you won't use any other tapered NC balloon. If you have some kind of hard, complex lesion, you just ask for give me the Lollipop and then you will finish the job. I think that's my opinion. That's my opinion.
Right. That's cool. Yeah, right.
Okay.
Well,
It's a little big thing.
Yeah.
It's a little thing, but helps a lot.
Yeah, of course.
Yes.
So I think we are here about to wrap our discussion, our meeting. If you say okay,
Sure.
if you have anything to add, please. So then, for the last but not least, I would like to conclude that these 3 thyroid complex PCI devices are helping us and will help us to ease the complex PCI procedure. That's my conclusion.
That's
Thank you very
Yeah.
much.
Thank you.